Welcome back to Chatting with Sonya and Friends. And we just wanted to thank Katie Confirm for Mercy Center for Women for stopping by and telling us all about, what it is that they have going on and the Women Making History for 2026. And now we are joined by Brandy Alexander of American Heart Association. Thank you for joining me, Brandy.
Thank you for having me.
Absolutely. Like I was saying before, it's been a long time coming, and we finally got you in. We're still celebrating Women History Month. And so, Brandy, let's just get right into it. Okay. So you're into public health.
Yes.
And what made you, first of all, just tell us who you are.
Okay.
Like, let's just start there, because
okay.
I know you, and those people out there are probably like, who's that beautiful young lady?
Thank you. So my name is Brandy Alexander. I am the Community Impact Manager for American Heart Association. I've actually been in this role since December of 2024. It's actually a new role here in Erie. But before I started working at American Heart Association, my passion behind being in public health. So growing up, I was a curious child. I was the one always asking my mom who, what, where, when, and why. Like, why did this person have so much medicine in their cabinet? And, why is this person sick? And how can we help? Aww. And I think growing up, she saw the nurturing side of me and how I was so quick to want to help others. So she put me in programs. So in high school during the summer, I was at St. Vincent's for their Explorers program. Mercy's Northeast had a medical program. So going forward with that, I was able to go to school and further my education for my bachelor's and master's in public health. And ever since then, I've just always had a public health job. So putting where I am now, the knowledge that I have, I always say knowledge is power. So to instill that in the community that I live in and also the 19 counties I cover, I want people to understand about awareness and advocacy and knowing knowledge of themselves and their health.
And so what are some of the biggest health disparities that you're seeing in the community right now?
Oof, oh my gosh.
Is it that many?
Oh, not like that. I guess
okay.
it's more so right now, the previous conversation I had before I got here was about tobacco and vaping products and how, especially with our youth, that they're being targeted, the marketing is towards youth and trying to get them to understand what they're putting in their bodies and how, secondhand and thirdhand smoke is affecting their loved ones. Besides the tobacco vaping, of course, hypertension, it's a silent killer. So getting people to understand, to know their numbers of what it is to be hypertensive and what's critical and emergent, and having a good relationship with their primary care physician.
So do you think people we hear the hypertension, the silent killer, should people have blood pressure, monitors at home?
Yes. So that is
actually have one.
Oh yeah. Look,
I do. I don't use it all the time, but I do have one.
Okay. So that's actually one of the programs that we offer at American Heart Association. So I work with community organizations and clinics to offer blood pressure monitors to patients or, patrons at home, so they'd be able to check their monitors whether they are newly diagnosed with hypertension or if they have different medications that they're on. But knowing your numbers is the first step, I always say, and then understanding not only blood pressure but diabetes, if you have high cholesterol, because then you're able to take that initial step to then look at what other changes you can make in your health behavior so that you can live a healthier life. Okay,
and talk to us a little bit about women and disparities. We often hear, that heart disease impact women a little bit different than men. Why is that? How so? What are we doing that's impacting us more?
So women actually have more symptoms
more
than
stresses?
Men. Well, between heart attack and stroke symptoms, women actually suffer more symptoms. And that can look like shortness of breath, fatigue, dizziness, indigestion, which unfortunately align with other health conditions. So a lot of the times you'll see that women feel as though what they're experiencing, could be bigger or smaller than what it is. So that's why we encourage patients to have a good relationship with their primary care physician. So if you have high blood pressure, right? And you're experiencing those symptoms, then you'll be able to know I should make an appointment with my doctor or I should go to the emergency room. Because a lot of the times people confuse symptoms with like stress, anxiety, or like heartburn. And then they're kind of confused and conflicted as to what they should do. And unfortunately, like I said, hypertension is a silent killer because it's going untreated and undiagnosed. So it's just best to know yourself and your body and then taking that initiative of the next step.
And some of the symptoms, if you was like really bad headaches. Or,
yes.
And do people always have shortness of breath? Like, is that just one of the symptoms?
Yes, so shortness of breath is one. There's actually some pain and discomfort in your jaw, your neck, your shoulder, and your back. Some people experience nausea, vomiting. So again, things that can align with other health conditions where someone could be confused as to, I don't know if I'm just sick, or like, again, I said heartburn or anxiety, that tightness in your chest. But like I said, knowing your levels. So if you know that you have high blood pressure and experiencing those symptoms, then we would advocate for that person to call 911 or to make an appointment with their primary care physician.
And I was going over some of the diagrams that you sent, and men, different symptoms. Are they totally different symptoms?
Not always.
Okay.
With men, it could differ amongst women, but there are some similarities. I think it's just depending on the person, right? And if they're on other medications. But overall, we always say, when in doubt, make that appointment, especially if you have a good relationship with your provider. They'll know, especially with hypertension, or if you have other health conditions and you're diagnosed, you'll have follow-up appointments. So they'll be able to keep a closer eye on you to help monitor you and your levels.
And so how young is too young to even be thinking about heart disease?
There is no age.
Like, I mean, when we see like young athletes like having heart attacks right there on the court.
Yes.
So is it fair to say the 20-year-olds should be checking their heart health and stuff too, right?
So the myth that a lot of times that we see, especially with our youth, is that heart disease is an older age disease, but it actually can affect all ages, which is why for myself, I was a big advocate for preventative health care, right? Getting ahead of the problem before it becomes a problem, versus those who see tertiary health care, which is towards the end where you're, on medication or making those lifestyle changes in between. But for youth, everyone thinks they're invincible, right? I was 16 years old and I thought nothing could ever happen to me.
Right.
But we have something that's called Life's Essentials 8 at American Heart Association, and we talk about healthy factors and healthy behaviors. And it's basically what we can control. So our sleep, having adequate hours of sleep, nutrition, so eating right, physical activity, and no tobacco, vaping, and then things that we can't control, right? So hypertension, diabetes, cholesterol. If it's something that's in your genetics, it's something that is most likely going to happen, but if you can make the right choices to prevent it, that's what we want the young generation to understand.
But we'll be right back.
Okay.